Hi, I'm Dr. Mary Gregory. I'm a pediatric optometrist at Uptown Eye Care in Monticello, Minnesota. And I wanted to share just a couple of pieces of information about when to bring your child in for their first eye exam. We actually do their first eye exam between 6 and 12 months old. And I know many of you wonder, how do they know when a baby needs glasses when you see those little kiddos or babies in glasses? But it really actually isn't that difficult. And we can get a lot of information that we need at that age. Our brain has a lot of reflexes. And so there are ways that we can check those reflexes. We can check the baby's prescription. We can check the health inside the eye. Your eye is one of the only organs in your body we can see inside, and it's brain tissue, and we can see your vascular system. And so we can identify if there's anything unusual. People and babies too can have birthmarks and freckles and moles and types of things inside their eyes too. So we're checking for that. But we want to check after 6 months old for eye teaming. Is their brain utilizing both their eyes at the same time? Are they able to relax their vision, see far away? We can check their acuity. Yes, they cannot tell me if they're seeing a picture or a letter on the board or at the acuity chart yet, but we can tell through their reflexes if they're seeing details or not, which is really important. Probably the most important thing that we're looking at is what their prescription is. And that is not a challenge for us to figure out. We can determine what a baby's prescription is. Babies are typically born farsighted. That means they can see better far away than up close. What that really means is they have to work and focus their eyes everywhere they're looking. Now, vision has to develop in the brain, and the brain's vision is back in the visual cortex, which is in the back of the brain. So at birth, vision is developing from eye back to brain, and we want to make sure they're on the right track. Having an equal prescription in both eyes and having a moderate to mild amount of farsightedness is ideal. This is easy for us to check. And if we're finding something that looks out of the norm, then we're able to follow your child a little bit closer to make sure they're not developing a lazy eye, we call amblyopia. Amblyopia is the leading cause of a vision loss in children, and it's preventable. The reason we don't catch it, and it's the leading cause, is because you looking at your child can't tell if they're seeing or using one eye or both eyes. Your pediatrician can't tell if they're following on track with all their visual developmental skills or what that prescription is. But a pediatric optometrist can do that, and we can make sure we're getting them in the right place at the right time for all of their vision skills to develop equally in both eyes, to make sure that by the time they're growing and hit the next time we want to see them for an eye exam, which is 3 years old, assuming everything is normal at the baby exam, we want to see them back at 3, and then kindergarten, first, second grade. Really important years. By kindergarten, we want their visual skills, their entire visual system to be developed enough to be able to sit, pay attention, and begin to learn to read. Get your baby's eyes in. There's a free program called Infant C, and you can find information on Infant C at infancy.org. This is a volunteer program throughout the United States where pediatric optometrists volunteer to do no-charge infant eye exams, just specifically looking for any kind of developmental issues that might be occurring right away. By the time your child's 3, they'll sit in the chair and do almost an entire big kid exam. And that's the next time we want to see them. They're halfway through that developmental milestones and in their visual system, make sure they're on the right track. After that, really important to be watching kindergarten, first grade, second grade. They're learning how to read. They're learning how to sit in a desk. Now, even looking at a digital device, they're learning how to cross their eyes and zoom in and track accurately. And sometimes when those skills aren't developing correctly, they're going to struggle. They're going to struggle to pay attention. They're going to struggle with early reading and learning skills. And those are things that we can pick up in an eye exam. If you have any more questions, feel free to check us out on our website. You can also email us anytime.